Hi, good morning. I'll make a start. I'll just go straight into it. We've real pride in our work at Calderdale and Huddersfield NHS Foundation Trust, and through the pandemic, and though the pandemic has been a challenging time, it's also given us a lot of opportunities to grow and develop our support. Today, we want to share with you the passion our patients and healthcare professionals have, and where we feel we've innovated to provide the best possible care for our support for our patients and their families. Those of us here today are part of the wider cancer team at Calderdale and Huddersfield NHS Foundation Trust. I'm Christopher Button, I'm the lead cancer nurse in the trust, and I'm joined on this presentation this morning by Mandy Davis from the Macmillan Cancer Information Service and David Blunt, our patient representative. Next slide, please. So patient co-design has always been integral to developing cancer services and supporting the trust. And prior to the pandemic, we had good patient education and support programs that had been co-produced with our patients. When the pandemic hit, it was more important than ever to ensure that patient education and support programs were still available for our patients. The fact that we had an established patient focus group and that we were a digitally enhanced trust, so we had electronic patient records, we were already using the Microsoft Teams platform prior to the pandemic, and coupled with a proactive IT team, all formed a great foundation on which we built our successful digital support for cancer patients, which you're going to hear about. With this support, we brought together patients and staff to discuss what and how we should deliver our digital support offering. So I'm now going to hand over to Mandy to tell you what happened.
Next slide, please. With the help of our cancer patient focus group, we listened to patients when they said they wanted more support and diagnosis. So we set up our First Steps programme. Patients said they wanted more peer and emotional support, so we created a virtual support group and started to run the I Hope course, which is a positive psychology course that can help with the stress of cancer. Patients and carers said they wanted more education for people living with incurable cancer. We set up the virtual Thinking Ahead programme. Patients said they wanted more accessible information and to reduce the amount of paper information they were given. Therefore, the cancer app and the website was created. The next slide is an example of our web pages. This is our First Step programme for the newly diagnosed patients and family members. Next slide, please. Other digital developments include, we produced the First Steps DVD to ensure we can provide patients access to information if they're unable to join the online programme. We also hold quarterly online end of treatment events which provide support for patients living with and beyond cancer. The topics include managing emotions, exercise, social prescribing, and a session with the clinical team. We also worked with the Head Wrappers team who provide monthly virtual hair loss sessions. Prior to the pandemic, we launched a programme for patients living with incurable cancer. This is called Thinking Ahead. We work closely with the Trust from Leeds and Harrogate to establish a collaborative course, which we host via Microsoft Teams. The programme runs for 7 weeks, covering a range of topics, which are delivered sensitively, empathetically, and professionally. The collaborative working means we can use professionals from all 3 trusts to support the presentation of the course. Many patients say it is not something they thought they would have to attend, but they are grateful that they did. Next is a short video of the previous attendees, course attendees, which was produced to help encourage more people to attend. Following the video, you will hear about David's experience. Could you play the video, please?
I can't really think of anything that I don't like about the course. I mean, the Thinking Ahead course is so well put together.
The things that were beneficial to me and what had an effect on me was end-of-life care. It's not something you tend to talk about when you're fit and well, and suddenly you have to think about that. It upset me, it made me talk about it. I would not have approached it without the help of the lovely people that I could talk to.
Certainly within the course, I would say that I've gained knowledge. Without that knowledge, it would be even tougher than what it is going to be facing the future. But I think the overall is the support that you get. And it's not just on the course, it's when you're finished.
If you can put those worries on one side that are really troubling you and have some experts say, this is how we can deal with it and we'll help you to do it, it takes away the fear of what it might be like at the end. And that has helped me enormously.
So much of a cancer diagnosis is mental. I think as long as you've got people to talk to, you can get away with that. And that's where the course definitely comes in, somebody to talk to. But the Macmillan gang won't be without them.
Good morning. I was first diagnosed with kidney cancer in September 2020 and had my first operation in October. Consequently, I've only known virtual support, but having spent the latter part of my working life presenting to a broad section of people, from colleagues at work to the EU in Brussels, I do have extensive experience of this format. After my operation, I was persuaded by my daughter to participate in the First Steps course to learn how to cope with cancer and also the impact of it on the family. Having been impressed with how First Steps was presented, particularly having the input from an individual who had gone through the experience, and also being persuaded to give it a try by the Macmillan team, I enrolled on the I Hope course. This was to go more in depth about how to support myself and highlighting other services that could support me. I was particularly impressed by the input from the facilitators on the course, directing without taking over and giving lots of encouragement. This persuaded me and others on the course to join in with other virtual support groups run by the Macmillan team, virtual walks, coffee mornings, etc., to continue this support ongoing. Finally, I've become involved with the Cancer Patient Focus Group, run virtually with the cancer team, oncologist and trust senior manager, to listen to the patient voice and recommendations. Suggestions from this group have been used to shape the courses and groups offered to cancer patients and how they should be run. Next slide, please. So, from my initial involvement and having to be persuaded to join at the end of the I Hope course, I did a virtual review. My thoughts being, lots of people write reviews, but most go unnoticed, and this might have more impact. I then became a volunteer for Macmillan and CHFT so that I could hopefully give something back to support other patients. This has enabled me to be trained as a facilitator and pass on the benefits and experience in running the course as a helper to the team. I'm also one of the patient reps who are involved with First Steps as previously discussed. I've now shared my story and become involved with not only the CHFT and First Steps, but also with the Cancer Alliance and Yorkshire Cancer community. Finally, I'm also involved in a wider scale with the Cancer Alliance, regularly attending various online meetings to represent the patient voice. All this instigated by the Macmillan team, persuading me to join a course and their professionalism in running it. Thank you. Next slide, please.
Thank you, David. And I think what's important is that we haven't stopped there. We've been collaborating with other trusts regionally and nationally to share our learning and best practice. Our First Steps programme has been implemented in other trusts regionally and nationally, and other teams have joined several meetings with staff the length and breadth of the country, and we're freely sharing our content. The Thinking Ahead programme has developed into a collaboration across 3 trusts, as already previously highlighted, but there's a potential use for that to go more widely across the Alliance and indeed nationally, as well as using this along for non-malignant patient groups. We've also been doing the rounds of NHSE, West Yorkshire and Harrogate Cancer Alliance and Macmillan webinars to share our learning as far and wide as we can. Final slide, please. There's no doubt that the pandemic has acted as a catalyst and indeed pushed our boundaries. Our Trust IT team were key to the success of our digital support, and without them, we wouldn't have been here today. It's also been a privilege to work closely with our patients and family members to listen to their views and suggestions, and for them to take a key role in designing the right support at the right time for them. And it's interesting to see how each of the educational offerings that we have developed are all different and are all based on patients' needs within that group. Face-to-face meetings will be introduced, but we also know that virtual offering will stay and enhance our overall provision. We're looking forward to continuing to work on digital innovations in the future. with our cancer patients and remaining healthcare professionals. And the final word is just thank you to everybody here, but also thank you for listening.